Welcome, fellow dental practitioners. I'm Dr. Theodore Belfor. This presentation is designed to give the viewing dentist an understanding of what is possible to achieve using the Homeoblock functional appliance. This unique appliance is worn by your adult patients during the nighttime only. Let me repeat that, during the nighttime only. In the year 2000, Dr. David Satcher, the Surgeon General, marked a milestone in dental history by issuing the first ever Surgeon General's report on oral health to the nation. In this report, he indicated that oral, referring to the mouth, includes not only the teeth and gums, but also the supporting tissues, such as the hard and soft palate, the mucosal lining of the mouth and throat, the tongue, the lips, the salivary glands, the chewing muscles, the upper and lower jaws, and also the tissues of face and head that surround the mouth. In short, the craniofacial complex. The Homeoblock appliance stimulates development in the craniofacial complex in adults. It is able to straighten teeth, enhance facial appearance, decompress the temporomandibular joint, and improve airway function. Therefore, in fact, the Homeoblock appliance can enhance the general health of your patients. The following chapters will explain how the Homeoblock appliance works and show examples of how it straightens teeth and enhances facial appearance.
The focus of this teaching program is not about teeth. What we are attempting to show is that dental arch development results in jaw development, which in turn results in facial development. Furthermore, we intend to link underdevelopment to temporomandibular joint disorder and sleep and breathing disorders. We as dental professionals spend so much time concerned with teeth that we easily overlook the larger picture, which should include neuromuscular dentistry and the health of the patient's airway. Intraoral expansion appliances have been around since the turn of the last century. Why is this appliance different from all other appliances? And how does it work? The Homeoblock appliances for the upper and the lower arches will always have an acrylic bite block on one side only. The Homeoblock appliances for the upper and lower arches do not come in contact with the soft tissue. Long arm flap springs come into contact with as many teeth as possible when the appliance is worn. The patient expands the appliance, turning the key from the back of the arrow to the front of the arrow, which equals 1/4 turn of the screw, or 0.25 millimeters. The screw is advanced 1 time per week. The 0.25 millimeter of expansion is roughly the equivalent of 300 microns, the width of the mid-palatine suture. This rate of expansion is physiologic. When the appliance is worn at night and the patient swallows, the lower teeth come into contact with the unilateral bite block. This sends a signal to the genome in the osteocyte via signal transduction through receptors in the periosteal membrane. The long arm flap springs send signals to the genome in the osteocyte via signal transduction through receptors in the periodontal membrane. Negative pressure on the interpalatine suture begins a process of bone remodeling at the suture. The expansion screw is advanced to keep up with the changes due to the remodeling of the bone. When the appliance is worn, saliva pools under the acrylic plate. When we swallow, the tongue pushes up against the acrylic plate, which flexes. When the pressure is relieved, negative pressure is exerted under the plate at the mid-palatine suture. The flexion itself causes the long arm flap springs to exert minor forces on the teeth, thereby sending signals to receptors in the periodontal membranes of the individual teeth. Due to a cascading series of events, these signals pass through the cell membrane to the nucleus of the osteocyte. This type of communication to the genome in the nucleus of the osteocyte has been outlined by Dr. Melvin Moss in a paper published in 1997. Dr. Moss was the head of the Anatomy and Cell Biology Department at Columbia University. Dr. Moss introduced us to the functional matrix hypothesis. This patient, that we refer to as modern man, has many of the characteristics of an underdeveloped midfacial region. There is a distinct lack of facial symmetry and little evidence of the supportive bone structure that is associated with a well-developed masticatory apparatus. The patient shows edema and inflammation of his lower eyelids, with venous pooling below. The supportive structure of prominent cheekbones is not apparent. His mouth is asymmetrical and the mandible appears weak. Intraorally, we see maxillary and mandibular crowding of the teeth, consistent with an underdeveloped maxilla and mandible. This photo shows the Homeoblock appliance in place. Over the next few photos, we will show 8 months of development. The patient wears the appliance anywhere from 6 to 10 hours, placing it in his or her mouth in the evening after dinner and wearing it all night long. As the bone of the dental arch remodels, the expansion screw is advanced. As space is created, the teeth move into their proper positions. These are animations of the changes that took place over the 8-month period. Notice that the arch shape, tooth alignment, and symmetry are enhanced. We also observed an opening of the expansion screw between 6 to 8 millimeters and an increase in dental arch width without tipping of the teeth. Note the before and after photo. This arch development and its associated jaw development result in facial development. Notice the enhanced facial symmetry. Both the eyes and the mouth are more level and symmetrical. There is a reduction in the edema and venous pooling under the eyes. The cheekbones are more prominent and the lower jaw appears to be stronger. Consistent with the widening and remodeling of the palate is an enhancement of the oropharyngeal airway space.